Your urine is basically a live diagnostic readout streaming straight from your bloodstream, and its color can shift from crystal clear to nearly black depending on hydration, diet, medication, and sometimes what's going wrong inside you. Clear urine. Clear urine is urine so diluted with water that it's lost almost all of its natural pigment, looking closer to tap water than to anything biological. This happens when fluid intake outpaces the kidney's need to concentrate waste, and it's common after chugging several glasses of water in a short window, or during intense rehydration after exercise. The kidneys function like a filtration plant running at maximum flow rate. Normally, they hold back and concentrate the yellow pigment that gives urine its color. But when water floods the system, that pigment gets diluted down toward invisibility. The same way a few drops of food coloring vanish into a swimming pool but stay vivid in a shot glass. Unlike dark amber urine, which signals the kidneys are conserving water because the body is short on it, clear urine signals the opposite extreme. The body has more water than it currently needs and is flushing the surplus. Marathon runners and people following aggressive water loading advice will often see this color repeatedly in a single day. However, persistently clear urine isn't automatically a badge of perfect hydration. Drinking far beyond thirst can dilute electrolytes like sodium, and in rare extreme cases, this contributes to a dangerous condition called hyponatremia. More water isn't always better, and your kidneys will happily prove it by turning your urine into something indistinguishable from what came out of the tap. Pale straw yellow. Pale straw yellow is the color most doctors and physiologists point to as the ideal baseline for well-hydrated, healthy urine, sitting somewhere between clear and a rich golden hue. The pigment responsible is urobilin, a breakdown product created when the body dismantles old red blood cells and processes the leftover heme into bilirubin, which the liver and gut microbes further convert on its way out. Think of it like a dye factory running a single, well-calibrated production line. Red blood cells are recycled roughly every few months, and their breakdown pigments get funneled at a steady, moderate rate into the urine, producing a consistent light yellow rather than an intense or washed-out color. Compare this to dark amber urine, where that exact same dye factory is still running, but the water carrying its product away has been reduced to a trickle, concentrating the pigment instead of diluting it. Pale straw yellow is what shows up in a well-hydrated adult drinking water regularly throughout the day, and it's the color most urine test strips and hydration charts use as the visual anchor for normal. It requires no dietary trigger, no medication, and no underlying condition to produce. It's simply the resting state of a functioning renal system with adequate fluid intake. The irony is that something this unremarkable is actually the goal every other color on this list is measured against. Dark yellow and amber urine. Dark yellow and amber urine is concentrated urine, where the same urobilin pigment responsible for normal yellow coloring is present in a much smaller volume of water, making the color look deeper, almost honey-toned. This is the kidney's water conservation response kicking in. When the body senses it's running low on fluid, hormonal signals cause the kidneys to reabsorb more water back into the bloodstream before the remaining waste is excreted, shrinking urine volume without shrinking the amount of pigment it carries. It's the biological equivalent of reducing a sauce on the stove. The flavor compounds don't disappear, they just get more concentrated as the water boils away, turning a thin liquid into something richer and darker. Compare this directly to clear urine, which is the same pigment system diluted rather than concentrated. Both extremes come from the identical urobilin pathway, just with radically different water content around it. Amber urine commonly shows up first thing in the morning, since hours of sleep without drinking naturally concentrates overnight urine. And it's also a reliable early warning sign during illness, heavy exercise, or hot weather when fluid loss outpaces intake. However, if dark amber urine persists even after rehydrating, it can point to something beyond simple dehydration, including liver or bile duct issues that alter how bilirubin is processed before it ever reaches the kidneys. Amber urine is the body's most basic, most frequent warning light, and most people ignore it until thirst forces the issue. Orange urine. Orange urine is urine that has shifted past the normal yellow spectrum into a distinctly orange hue, usually because of a compound in the bloodstream that wasn't there before, rather than simple concentration. Certain medications are the most common cause, particularly rifampin, an antibiotic used for tuberculosis and some other infections, along with phenazopyridine, a urinary tract pain reliever specifically designed to color urine orange as a visible side effect. Picture the kidneys as a checkpoint filtering everything in the bloodstream. Most of the time, only the routine yellow pigment gets waved through. But when an orange-tinted drug compound enters circulation, the checkpoint filters that out too, and it exits mixed in with the usual urobilin, shifting the overall color toward orange. Unlike dark amber urine, which comes from concentrating in unchanged pigment, orange urine usually reflects the presence of an entirely new compound being cleared from the body. Severe dehydration can occasionally push normal yellow urine dark enough to look orange as well, so the color alone doesn't confirm a cause without context, like recent medication use or fluid intake. Liver and bile duct problems can also produce orange urine when excess bilirubin spills into circulation before the liver can properly process it, often paired with pale, clay-colored stool, since the pigment isn't reaching the intestines as it should. The twist is that orange urine can be something as harmless as a prescribed pain reliever working exactly as intended, or a subtle signal that the liver's pigment-clearing system is starting to fail, and the two causes can look identical in a cup. Pink and red urine. Pink and red urine is urine tinted anywhere from a faint rose to a deep, alarming red, and the cause splits into two very different categories: real blood or pigments from food and medication that only look like blood. Beturia, the reddening of urine after eating beets, happens in a meaningful minority of people whose digestive systems don't fully break down betalain pigments before they're absorbed and excreted, and it's completely harmless. True blood in urine, called hematuria, can come from anywhere along the urinary tract, from a kidney stone scraping against tissue to a bladder infection, an enlarged prostate, or in some cases a tumor. Think of this segment like forensic evidence at a crime scene. The color alone tells you something happened, but investigators still need to figure out whether the red trace is truly blood or just a red substance that resembles it. And the only way to know for certain is laboratory testing. Compare this to black urine, an equally alarming but far rarer color that usually points toward a different pigment pathway entirely, often linked to muscle breakdown or specific rare genetic conditions rather than blood. Vigorous exercise, especially long-distance running, can cause a temporary, harmless form of blood in urine from minor bladder wall trauma, which typically resolves within a day or two. However, blood in urine should never be dismissed as automatically minor, because it's one of the few color changes on this list that consistently warrants a medical evaluation, regardless of how the person feels otherwise. Red urine forces a choice almost every time it appears: dinner or a doctor's visit. Brown and cola-colored urine. Brown and cola-colored urine is a deep, murky brown that looks closer to weak coffee or actual soda than to any shade of yellow, and it usually signals either severely concentrated urine or the presence of breakdown products the kidneys don't normally filter in large amounts. One major cause is myoglobin, a muscle protein released into the bloodstream during rhabdomyolysis, a condition where muscle tissue breaks down rapidly, often from extreme exertion, crush injuries, or certain drugs. Another cause is old, degraded blood that has been sitting in the urinary tract long enough to oxidize and darken, similar to how a fresh cut bleeds bright red but a healing scab turns brown. Picture the kidneys like an engine's oil filter. Normally, it lets clean fluid pass while trapping debris. But when the bloodstream is suddenly flooded with muscle breakdown products or degraded blood pigments, some of that darker sludge gets forced through into the urine, staining it the color of used motor oil. Compare this to pink and red urine, which usually reflects fresh, active bleeding, whereas brown urine often reflects blood or pigment that's already been chemically altered before it reached the bladder. Liver disease can also cause brown urine through excess bilirubin, similar to the orange urine pathway but pushed further along the same pigment spectrum into a darker range. The problem is that rhabdomyolysis, one of the more serious causes of this color, can also damage the kidneys themselves if left untreated, meaning the very organ trying to warn you about the problem can become a casualty of it. Blue and green urine. Blue and green urine is among the rarest and most visually startling entries on this list. And unlike almost every other color here, it's overwhelmingly caused by external substances rather than internal disease. Methylene blue, a dye used in certain medical treatments and dyes found in some medications and food products, is the most common trigger, passing through the kidneys largely unchanged and tinting urine a vivid blue or teal. Certain rare genetic metabolic conditions and specific urinary tract bacterial infections have also been associated with blue-green discoloration, though these are uncommon compared to medication-related causes. Think of the kidneys here like an ink factory that occasionally gets fed the wrong pigment cartridge. The filtration process itself doesn't create the color. It simply passes an unusual dye through mostly intact, the same way a clear filter doesn't change the color of liquid poured through it. It just lets whatever's there pass to the other side. Compare this to orange urine, which is also frequently medication-driven, but pulls the color toward the warm end of the spectrum rather than the cool end that methylene blue and related compounds produce. Blue and green urine tends to resolve quickly once the triggering substance clears the bloodstream, usually within a day or two of the last dose. However, because this color is so unusual, it can also cause understandable alarm in patients and caregivers who aren't expecting it, sometimes leading to unnecessary emergency visits for something that's often a predictable, harmless side effect. Few things test a person's calm quite like glancing down and seeing something closer to antifreeze than urine. Cloudy and milky white urine. Cloudy and milky white urine has lost its normal transparency, appearing hazy, opaque, or in some cases almost like diluted milk, and the cause ranges from completely benign to a sign of active infection. Urinary tract infections are among the most common culprits, since white blood cells, bacteria, and cellular debris mixed into urine scatter light instead of letting it pass through cleanly. A much rarer cause is chyluria, where lymphatic fluid rich in fats leaks into the urinary tract, giving urine a genuinely milky appearance. Picture normal urine like a clean glass window that light passes straight through, and cloudy urine like that same window suddenly filled with dust, fog, or condensation. The light doesn't disappear, it just scatters off all the extra particles suspended in the fluid instead of traveling straight through. Compare this to blue and green urine, where the color itself changes because of a dissolved dye, whereas cloudy urine keeps roughly the same underlying color but loses its clarity because of suspended solid or fatty material. Excess phosphate crystals, particularly common in concentrated, slightly alkaline urine, can also cause a temporary, harmless cloudiness that clears once the sample sits or is diluted. Dehydration alone can make urine appear slightly hazy simply by concentrating normal waste products closer to their saturation point. The twist is that cloudy urine sits at both extremes of seriousness at once. It might be nothing more than a few extra minerals, or it might be the first visible sign of an infection working its way up toward the kidneys. Black urine. Black urine is exactly what it sounds like. A color so dark it looks closer to strong coffee or ink than to any recognizable shade of yellow or brown, and it's rare enough that most people will never see it in their lifetime. One classic cause is alkaptonuria, a rare inherited metabolic disorder in which the body can't fully break down certain amino acids, leading to a buildup of a dark pigment that oxidizes on contact with air and turns urine black over time, sometimes only after the sample has been sitting for a while. Certain medications, heavy metal exposure, and advanced forms of melanoma have also been linked to black or near black urine in rare documented cases. Think of it like a photograph left in a darkroom too long. The underlying chemistry involves compounds that darken progressively through oxidation, So freshly produced urine might look only moderately discolored, then continue deepening in color the longer it's exposed to air. Compare this to brown and cola-colored urine, which shares some overlapping causes like severe pigment buildup, but rarely pushes all the way into true black without one of these rarer underlying conditions present. Because black urine is so uncommon, its appearance carries more diagnostic weight than almost any other color on this list. Doctors take it seriously precisely because harmless everyday explanations are much less likely to produce it. It's one of the few urine colors where wait and see is rarely the right response, mostly because there's rarely an innocent everyday reason for urine to look like ink. Purple urine. Purple urine is an unusual and specific phenomenon most often seen in patients with long-term urinary catheters, where the color develops not from a single pigment, but from a chain reaction involving bacteria, urine chemistry, and the plastic tubing itself. This condition, sometimes called purple urine bag syndrome, occurs when certain bacteria in the urinary tract metabolize the amino acid tryptophan into compounds called indigo and indirubin, blue and red pigments respectively, which combine to stain the catheter bag purple. Picture this like a small chemistry lab operating inside the urinary tract, where specific bacterial species act as the workers running a multi-step reaction. Raw material goes in as tryptophan, byproducts, and finished purple pigment comes out, gradually staining anything the urine sits in contact with, especially the plastic material used in catheter bags. Compare this to cloudy and milky white urine, which is also frequently infection-related, but purple urine specifically requires the right combination of bacteria, alkaline urine, and prolonged contact time with a catheter to produce its distinctive color, making it far more situational. This condition tends to appear more often in older adults, particularly women, with long-term catheter use and chronic constipation, both of which favor the bacterial conditions needed for the reaction. However, despite its dramatic appearance, purple urine bag syndrome is often more visually alarming than medically dangerous on its own, though it does typically indicate a bacterial presence worth evaluating. It remains one of the strangest examples in medicine of ordinary metabolism, bacteria, and plastic combining to produce a color nobody would expect urine to turn. Foamy and bubbly urine. Foamy and bubbly urine is urine that produces a persistent layer of froth or bubbles in the toilet bowl, rather than the small, quickly disappearing bubbles that come from a fast urine stream hitting water. A strong, fast stream can create temporary foam in anyone, but urine that stays foamy consistently, especially with only a light stream, often points to excess protein being lost through the kidneys, a condition called proteinuria. Normally, the kidney's filtering units hold on to proteins like albumin, keeping them circulating in the bloodstream where they belong. When that filtration barrier is damaged, protein leaks through into the urine. And protein happens to reduce surface tension in liquid, the same way dish soap does, creating stable, long-lasting bubbles instead of ones that pop within seconds. Picture the kidneys as an extremely fine mesh sieve, designed to let water and small waste molecules through while trapping larger proteins, similar to a coffee filter holding back grounds while letting liquid pass. When that mesh develops gaps, larger molecules start slipping through that were never meant to escape. Compare this to cloudy urine, which involves suspended particles scattering light, whereas foamy urine involves a dissolved substance changing the physical properties of the liquid itself. Occasional foam after a large, fast urination is generally nothing to worry about. But foam that appears consistently, day after day, warrants attention, since ongoing protein loss can be an early marker of kidney damage from conditions like diabetes or high blood pressure. The bubbles themselves are harmless, but persistent foam is often the kidney's quiet way of announcing that their filtration system isn't holding the line the way it should. From clear to black, purple to foamy, every shade on this list traces back to the same underlying system: a pair of organs constantly filtering, concentrating, and releasing whatever the bloodstream hands them, turning diet, hydration, medication, and disease into a color code anyone can read without a single lab test. Subscribe if you want your body's other warning signs decoded just as clearly.